Hi everybody, my name is Dr. Vallecillos and I'm a plastic surgeon in Beverly Hills in Larchmont Village. Welcome. We are at DMH, which is my non-invasive state-of-the-art medical facility, and today we're going to be talking about Coolsculpting. In lieu of Father's Day, I have two dads here that are going to be treated, and we're going to go over the entire process of Coolsculpting, what it is, what the benefits are, what it'll do for you, risks, everything you want to know about Coolsculpting. By the time you're done with this little program here, you're going to be a pro at Coolsculpting. So we're going to get started today. We're treating Rob right here. Rob, how you doing?
I'm doing good.
Good. And Rob's come in today because he has a couple areas of concern, that being his lower abdomen that he wants treated. He's got a little bit of excess fat there, so he came in for Coolsculpting. So what does Coolsculpting do? Coolsculpting will get rid of fat in any specific area that you need treated. There are a number of areas that are on label for treatment. So we can go over those later to figure out if those treatment areas are right for you or wrong for you. The way the procedure works is it freezes the fat, just like you hear on TV, just like you see on billboards. What it does is that we place the applicator on. Once the applicator is on, we turn on the device, and then the fat gets drawn into the applicator and it starts a cooling process. It takes about 35 minutes. During that process, that fat gets frozen to the point that it is no longer sustainable, and then over the course of weeks and weeks and weeks, it goes away, and then you see a modest result over the course of about 8 to 12 weeks. Rob, how you feeling?
It's a little cold, but it feels great.
Yeah, it's not bad. It's pretty well tolerated. I'm going to show the applicator right here. Okay, we're treating Rob's lower abdomen, which is a common area that we normally treat men in. Most men with Rob's body style come in for treatment of the lower abdomen. I have had my lower abdomen treated as well. So for guys like Rob and me, lower abdomen are areas that we tend to retain fat. No matter what we do, no matter how much we exercise, that fat won't go away. So this treatment addresses that. It also addresses the flanks, which I think Rob may be treating later. And then the way it works is that once it's on, it'll be on for about 35 minutes. Treatment process is over, and then we massage the area out and you're done. Is it safe? Coolsculpting is very safe. Once you come in and get assessed, we make a determination if you're healthy enough to have the procedure done, which most people are. Assuming you are, you check off all the criteria, you can get it done, and there's very, very little risk with this type of procedure. Does the fat come back? The fat usually does not come back if you maintain a healthy lifestyle and diet. So you can out-eat lipo. You can eat a bunch of food, gain a bunch of weight, and you can even out-eat lipo just like you can Coolsculpting. But in general, once the fat is gone, it is a long, long-lasting result, okay? So we're going to move on over to Tyler in 1 minute. Before I do, we're going to answer one question. How long does this treatment need to be done for before you see a result? So, for example, if you're getting married, let's say in August, okay, you want to have a good result, I would have this treatment done anywhere from 8 weeks to 12 weeks beforehand, 8 to 16 weeks actually, and your body will metabolize that fat over time. All right, now we're going to jump over to Chelsea and watch the entire process from the beginning to the end. And once we're done with that, we're going to come back here, pull this applicator off Rob, and we're going to massage the area out, and we'll actually see what the treated area looks like, and then Rob can give us some feedback as to whether the experience was good, mediocre, if he was in a ton of pain, no pain, we'll see. Right, Rob?
Right.
He's smiling, he's not in pain. Okay, so now we're going to come over here and go and see Chelsea.
Hi everyone, my name is Chelsea and this is our patient, Tyler.
Hello.
So Tyler, why don't you tell me what some of your problematic areas are?
All right. Well, yeah, I do a lot of working out. My wife's got me on like this paleo diet, so I'm trying to eat healthy.
Awesome.
But no matter what I do, I can't seem to get rid of this problem area right here. You know, really just trying to get that Ryan Gosling body. You know,
Perfect.
just get that V. And so happy to see what you guys can do to help me out.
Awesome.
Yeah, so Coolsculpting can definitely help you out with these problematic areas. Since you mentioned your lower abdomen, what I'm going to be looking for is basically any fat bulges or fat pockets that are protruding out, and so we want to flatten those out. So just assessing you right here in this lower abdomen area, I see that he has 2 fat bulges right here, right on this side and one on this side. And as I'm pinching, I can automatically, even just without pinching, I can see that this side right here is slightly bigger than this side right here. So you have a little bit of asymmetry, but that's normal. I mean, our whole body is like not perfectly symmetrical. So I'm going to assess this side first, and I'm pinching I know where the peak of the bulge is, and I'm pinching to see the distribution of the fat and where it ends. So it kind of ends right here on this side where it's a little bit thinner, and the bulk of it is right up here. So I'm going to be feeling it around to kind of see where it ends and where it stops, right about here too. So I'm using these applicators to kind of mark up your area here to see how it lies. Put that right there in the center, and I'm going to draw it out right here. So this is kind of the line area that I'm going to be focusing on. This is the template for the applicator. This is how big we're going to be placing it right there. So I'm putting the circle right on the peak of the bulge. That's going to be the coldest part of the applicator, and that's where I want it to be, right on top of the bulge. Right here. Just going to draw this out, and I pinch to make sure I just got it right, and that looks good. So now I'm going to go over to this side, okay? Right here, I already kind of marked where the top of the peak is, and I'm going to start feeling around for the bulge and then where it ends. So it kind of ends right about right here. And I might have some overlapping a little bit, and that's okay. You can do some overlapping.
Okay, and as Chelsea is preparing Tyler for his treatment for transformation, we're going to go over how the fat is eliminated. So the fat doesn't just go away. Basically, the fat gets treated in the specific areas that Tyler has concerns about, and the fat gets frozen over the period of the treatment. And then from there, your body is going to metabolize it over the course of weeks to months. So once the fat dies, the cells are dispersed, and you slowly just dispose of it in really, really slow increments. So it's not an overnight process. If you have it done today, you're not going to see a result tomorrow. You'll see a result in several weeks.
So right now I am also going to be marking his love handles, his flanks, because he wants that nice V shape like Ryan Gosling. So we're going to give that to him.
Notebook body, you know?
He wants that notebook body. So I'm going to be looking at where the fat stops and ends. So it's kind of flat right here. I'm going to mark that and then see how far down it goes. So it's right about here.
And this treatment's great because you can essentially treat all skin types. You can treat all ages, young to old. There's no real limitation on how young or old you are. You have to be at least 18, obviously.
Same thing on the other side. Kind of looking to see how flat it is. Right about here. And pinching. Is this okay?
Yeah.
Okay.
And as you can see here, Chelsea's doing a great job of the assessment. And really, to get an optimal result, you need to come in and get assessed and make sure that you're a good candidate for these procedures. Most people are, some people are not. It really is going to depend on what your end result wants to be. So whatever your expectation is, we can probably meet it within reason, but the best way to determine that is by coming in and getting assessed by a professional like Chelsea.
So I just finished marking his flanks. I placed it right in the area where I know I'm going to contour his body to achieve that V look. So looking him straight on, I can tell that the bulges are right where my markings are, and that's what we're going to be treating today. So what I'm going to have you do, Tyler, is I'm going to have you actually lay down on the bed so we can get started. I like to put a little bit of a pad here so it doesn't get on your clothes. So I'm just going to tuck this in here. We're going to start with the abdomen first since he's laying flat. Pull that down.
Okay, and Tyler, one question you might ask is that after this is done, do you need to come back in a year to have it done? The answer really is no. This is a long-lasting result, and assuming you continue to eat well, exercise well, this result will last you a long, long time. If you decide to gain 100 pounds, all bets are off. But I'm assuming you're you care about the way you look and feel, so you're going to continue to do the same thing, and this result will last the test of time.
Wow, that's great news.
Yeah.
So what I'm doing right now is I am just cleaning the area with a pre-treatment wipe. It's making sure that any excess oils that are on your skin are wiped off and it's clean, and it's also used as a protective film barrier to protect your skin with the applicator as well. You want to wipe this on for about a minute to make sure that it's thoroughly cleansed.
Chelsea, let's talk about pain. Does this procedure hurt or no?
Typically, on average, everyone has a different tolerance for pain, but it's pretty tolerable. I would say the first 8 to 10 minutes is gets a little uncomfortable because it's trying to get pretty cold.
Okay.
After that, it will get numb, and that you won't feel so much of that coldness, and it will remain numb for the remainder of the treatment. So I just finished cleansing, and now we're going to put on his gel pad here. That's also used as a barrier.
Great.
Here, if I can open it. So, can you open this for me, Dr. Baser?
Of course.
While he's doing that, I'm going to be getting the monitor ready, and I'm basically telling the machine what area we're going to be treating, and that's here, putting on the gel pad, and we're getting all of this ready. So this is the applicator, has the whole cooling panel here, that's going to get the whole area cold. So this is ready, I'm putting this on. It gets pretty sticky, that's why I like to keep my area nice and clean right here. So you want to lay it nice and flat on the area that I just cleansed, making sure that there's no folds in the gel pad.
Chelsea, speak a little louder.
Making sure that there's no folds in the gel pad. So make sure it's nice and tight on there. Apply this on, you're going to feel a little bit of a pinching and a tugging at first,
Okay.
and then it'll just remain like that for the treatment. 1, 2, 3. There you go. Hold that really quick for me. I'm going to be putting this pillow here to help support it. There you go.
Okay, now the device is essentially, it's drawing in your tissue, your fat, into the applicator.
Okay.
And then once Chelsea turns the machine on, it's going to start cooling the fat in a slow, modest process. You'll feel some cooling early, then it'll get pretty intense in the first 10 minutes, and then it'll get pretty numb. And the remainder of the treatment will be numb.
Yep.
And then when she takes it off, the fat's going to be frozen essentially. She's going to massage it out, and that may be the most uncomfortable part of this whole thing. Yeah, she's got to massage it out because she's got to create a nice confluent look and really break down all the crystals that were formed during the process. And that's it. From then on, you're free to do whatever you want. You can go back to work, you can go exercise, you can go to sleep, whatever you want. No downtime, no real limitations. It may be a little sore over the course of the next few weeks, but if it is, I would recommend just doing modest massages in that area. You get a little bit of induration, which is hardening of the fat. That's normal, even with like liposuction. So you just massage those areas out, and that will all go away. Okay. One thing this won't address is visceral fat. So what is visceral fat? Visceral fat is the fat that's around your intestines, that's inside your muscles. Okay. This device only addresses subcutaneous fat, which is the fat that's just under the skin. So if you need to lose visceral fat, stop drinking, stop eating bad foods, stuff like that, and consider exercise, okay?
Yep.
But you're a perfect candidate for it.
I'm going to start the treatment now. So you're going to start to feel that cold starting to cool.
And let us know what it feels like.
Yeah, it's not painful at all. I do feel it's getting colder now.
Okay, good.
Just like a little ice pack on,
Yeah.
on the belly. But no, even when you put it on, the first suction wasn't very abrasive at all.
Does the pinching hurt?
No, yeah, I don't feel much of the pinch. Just mostly the cold.
Okay, so that cold, like I had mentioned earlier, you'll start to feel that for the first 10-ish minutes.
Okay.
After that, it'll just subside and go numb, and it'll remain numb for the remainder of the treatment. And this treatment is about 35 minutes, like Dr. V had mentioned. And when we're done, I'm going to be taking it off and massaging that out for about 2 minutes.
Great.
And again, there's no real recovery time. Once she's done massaging, you can go back to life as usual, okay? No restrictions, no limitations. You can shower, whatever you want to do. And results, what are we now? We're in the second week of June. You can see best results we'll be seeing 16 weeks from today. So it'll take anywhere from 8 weeks to 16 weeks. And that's going to vary depending on your metabolism, how you eat, things of that nature. But on average, 8 to 16 weeks. Okay?
One of the questions that Tyler had was, how many treatments do you need?
Most people in our practice usually require 1 to 3 treatments, depending on how much fat you have, what your end result is, or what you want your end result to be. So it's going to vary from person to person. There's no real end game. For someone like you, 1 treatment will usually do the trick. It'll usually, and what it ends up doing too is it ends up kick-starting. It gets you more enthusiastic about looking better. So what you often see is people actually start eating better, start exercising more, just by getting this treatment done. So it's a good indirect way to.
It's a great jump start.
Yeah, definitely.
Definitely achieve that Ryan Gosling look.
Yeah.
And how long after this one's done will we be able to start the next application? Just from different areas.
For this area here,
Right.
or we can
Right.
start it right after. Yeah.
Okay.
Yeah. So we can do
On the
that,
other
and we can do your
side?
flanks.
Yeah, right when we're done with this side, we're going to be able to start the other side, and then we'll treat your flanks like
Yeah.
you just mentioned.
You can do multiple areas. The only constraint is your time constraint. So whatever your time allows, we can do.
Okay.
All right.
Oh, can you repeat that question someone was asking?
Yeah, I was just wondering, once this side is done, how long we'd have to wait for you to do the next side, but it seems like we can just go right away.
Right afterwards, yes. You can do it right afterwards. Sometimes, if this is feeling a little sore, me personally, I would work on the flanks just to give that side a little bit of a break, and then we can go back to that side. But it really depends on the patient's tolerance and how well they can, tolerate it.
Right. Good.
Very good.
All right. All right. Now we're gonna jump over to Rob and see how he's doing.
All right, thank
Okay,
you.
and we'll be back. Once you're almost tidied up, then we'll come back, take the applicator off, massage it out, and then be all set. Okay.
Great.
All right, buddy. Rob, still alive?
Still alive.
How's it going?
It's going good. It's just a little bit cold, that's all.
Okay, good. You're about halfway done now. It looks like maybe a little bit more. So, pain level 1 to 10, 10 being worst.
Oh, it's not painful at all.
Not painful at all.
Yeah, I was
Okay.
actually expecting worse.
And that's usually the findings we have. Most people do really well with it. There's no real. The people that have bad pain is near zero. I think I've never even heard of it. He's a good candidate for it because he's already in good shape. He's got really localized areas of fat. We get people calling in saying, I want to lose 50 pounds. Is this for me? This treatment will reduce fat in anyone's body, but if you're looking to lose weight, Coolsculpting or even Liposuction is not an option for you. It should be an adjunct procedure that you do to a healthy lifestyle, diet, and exercise. Is Coolsculpting safe? Absolutely, it's very safe. There's very little risk with this procedure, and most people do quite well with it. So how is the fat eliminated? Well, once the fat is treated, it's essentially frozen, okay? And that fat will then die over the course of time. It doesn't just go away overnight. It takes time for your body to metabolize it, and once it's metabolized, it slowly works out of your system, and over time you see the result. Okay, can we do Coolsculpting in more than one area? Absolutely. People will come in and they'll have multiple areas they want addressed, and really the only rate limiting step is going to be your schedule. If you can accommodate the time, we can treat multiple areas. Guys like me, guys like Rob, what areas do we normally treat? Abdomen, flanks, those are really common areas. Those require 1, 2, 3, 4 different treatments, and they can all be done back to back. And once you're done within a period of about 2 hours, a little bit over 2 hours, you're done. Treatment's over, you can go home. A lot of people call in and say this procedure does not work. It absolutely works. It addresses the fat is killed, it's frozen, it gets metabolized over time, and you will see a result. It's very unlikely that you won't see a result after one treatment, and that's why we recommend you coming in and we can assess you. You might need up to 3 treatments, but on average 1 to 2 will usually get you a good result. How much fat does it reduce? It'll reduce up to 25% of the fat in any given area at one time. So if I'm treating an area in the abdomen, I can expect, if I have, let's say, 100 fat cells there, I can expect to lose about 25 of them, okay? So when you come back sometime later, if you want that area treated again, you can definitely get that area treated again for even a better result. But keep in mind, since you already had that treatment done before, you're going to have less fat cells in that area. The result the second time around will probably not be as great as the first time around, okay? Okay, coming back again for more treatments. In general, once the area is treated, you don't need to come back. You can come back for a reassessment of other areas if you need it, but assuming you maintain your weight and you do all the right things that you're supposed to do, it's a long-lasting result and you don't need to come back for more than one treatment. Is it better than lipo? A lot of people ask me, is it better than lipo? It's different from lipo. This is non-invasive. So when Rob's getting treated here, there's no incisions, there's no anesthesia, there's nothing like that. He's, you know, he's in, treated, he gets out, doesn't hurt. Lipo has a lot of, you know, has a lot of downtime, there's risk, you need to have a binder on for some time, so it's a lot more of an involved procedure. You can definitely reduce fat with lipo, but for a lot of people, and especially now, you know, in the current age, everything is moving towards the non-invasives. That's where the direction of the market is going. So procedures like Coolsculpting are really laying the groundwork for, you know, better treatments that don't require surgery. So how much does it cost? That all depends on how much you need. You might need one procedure done, you might need multiple done, and that really will vary. So what I would suggest is to go into your practitioner and seeing what areas need to be treated, and then they can determine a package for you, and then from there they can come up with a price for you. What does it feel like? Okay, in general, what does it feel like? Coolsculpting in general doesn't feel that bad. When you first put the applicator on, you're going to feel some cooling, and then that turns into intense cooling. After about 10 minutes, you're numb. You don't feel a thing at all. And then once the treatment's done, we take the applicator off. We'll do some light massage to break up the ice crystals in your fat tissue. That part can be a little bit uncomfortable, but it's definitely well tolerated. Doesn't require pain pills, doesn't require anesthesia, nothing like that. How do you feel?
Oh, good. I have a question for you.
Anything.
When can I resume any kind of activity, working out, etc.?
Okay, you can go back to your normal life right away. So once you're done, once we massage you, go on your way. You can go straight to the gym, straight to the beach, whatever you want to do. There's no real limitations on your lifestyle whatsoever.
That's nice.
Okay?
Thank you.
Good, of course. A lot of people ask, is Coolsculpting covered by insurance? It is not. It's not covered by insurance, Medicaid, Medi-Cal, nothing like that. It's an elective procedure, and it's fee for service, unfortunately. Okay, another way we can use this treatment is for people that have liposuction. So what's one of the biggest risks of liposuction? Asymmetries, and what that means is that some areas can be left untreated, and you can have areas of excess fat. So instead of having to go back under the knife, you can just come in here, we address that area, assuming it's a treatable area like Rob's having done. We can place the applicator on and just treat that area and then create a good result. Areas you can treat. Can you treat under the chin? Yeah, you can definitely treat under the chin, and we'll assess that area to make sure the applicator fits on, but it's one of the most common areas that we treat. Can you have swelling after the procedure? You can have very, very mild to modest swelling. In my experience, you really don't have that much swelling at all, okay? Can Coolsculpting help to fix uneven liposuction? Yeah, we've gone over that a little bit earlier. It can definitely do it. Again, liposuction, one of the most common problems you can have is unevenness. And again, a lot of people don't want to go under the knife again. They don't want the downtime. So what we can do is we can use this device, address the area that's uneven, place it on, and then over time you'll get a lot smoother skin, and it creates a really, you know, optimal result in people that haven't had the best liposuction experience. Okay, weight loss versus fat loss. This procedure reduces fat in any specific area that you want treated. It's not a weight loss procedure, so you got to keep that in mind. If you want to treat the thighs, you can treat both thighs. We usually do one treatment on one side and do the second treatment on the other side. Okay, one question we get a lot is age. Can you treat any specific age group? The answer is yes. We've treated patients in here, funny enough, well into their 80s. The lower number is going to be 18. You have to be an adult to consent yourself for a procedure. But that window is, it's not limited by age, assuming you're, you know, of age to have the procedure done. So anyone's a candidate, assuming they're in decent health, and you got to come in to get that determined. If you're healthy enough to have the procedure done, and you're the right age, meaning above the age of 18, any age past that will suffice to have to move forward with the procedure. Is the consult free? Absolutely, the consult is free. So anyone can come in here and get assessed by Chelsea or Celeste or any one of the nurses that work in here, and we'll have them look at you, and then we'll determine what best treatment is going to give you the optimal result, and then we can move from there. Why do consults? Because you want to do consults because not everybody is a candidate. Some people don't have fat. Some people have visceral fat, so they have fat inside their abdomen. So if I treated someone that had fat inside their abdomen, their result would be minimal to none. And we want you to have a good result. We want you to have a good experience. That's why you have to come in here and make sure you're a good candidate for the procedure. If you're not, we can offer you other modalities. We can offer you diet plans, exercise plans, a lot of other stuff. But for this, you have to come in. Do you need to have many treatments? You really don't need to have many treatments unless you're going for multiple areas. If you're going for one specific area, like Rob's getting done here today, one treatment will usually do it. 1 to 3 treatments will do it on average. It's usually 1 to 2. If you want to have multiple areas done, yeah, then you need to come in and get multiple treatments, and it makes sense. This procedure is tissue specific for fat, so it's not going to hurt the skin, it's not going to hurt the muscle, the bone, the nerves, anything like that at all. It really only addresses the fatty area. So once that fatty area is addressed, the result will come shortly thereafter. Okay, now we're going to go to Rob and see how he's doing, and Chelsea's going to take down the applicator, and once she takes it down, she's going to massage the area out, and then Rob will be ready to go. And Rob, you can let us know what the experience is like as she's massaging it. In my experience, that was the worst part of the procedure, and that wasn't really bad at all.
How are you feeling, Rob?
I feel great.
Great. Does it feel cold still? Does it feel numb?
A little bit cold, but not uncomfortable at all.
Okay. Once I peel it off of you, the sensation will start to slowly come back.
Okay.
So just let me know how you're feeling as I go on. So in about a couple seconds, I'm going to take this off, and it's now complete. So I'm turning off the suction so I can easily pull this off. So I'm going to put my fingers in here. 1, 2, 3. So you can see the area is a little bit red. And it looks pretty frozen actually.
It does.
So what Chelsea's going to want to do now is massage that area out. You want to massage that area out because you want to break down all the frozen fat cells and create a nice confluent look. And if you do that, the result will be much better than if you don't.
I'm going to be massaging this area for about 2 minutes. While I'm massaging, you're going to feel a little bit of tingling, a little bit of burning sensation. Sometimes people tell me it's a little ticklish too.
It is a little ticklish.
Okay.
Okay, so Chelsea's massaging the area for a couple minutes. There's mild discomfort there. It can be a little bit tingly, but overall, well tolerated. As we can see, Rob, he looks pretty happy. He's not screaming in pain. He's screaming in joy.
It's way better than I thought, to say.
What did you think it was going to be like?
Well, I don't know. I was expecting more pain.
So it's good. It's less painful than you thought it was going to be.
Yeah.
Let me check this out. What are you doing here? Okay, so how do you do that? I'm not the massager. I'm just the good-looking guy.
massager.
She's the massager.
Professional fat massager.
What's the end point of massage? When do you stop?
In about 2 minutes. So I
Okay.
have a timer going on here, and I have about 50 seconds left massaging in this area. So I want to constantly massage the area until the 2 minutes is up.
Okay, so she'll massage it for about 2 minutes. As you can see, the skin is a little bit red, but it's not harmed, it's not dead, it's not hurt, it's not burned. No problems. People often ask, not that often, but occasionally, can this procedure cause a hernia? No, it cannot. Hernias are weaknesses in your deeper tissues. Keep in mind, this is a procedure intended for fat loss, not weight loss. So it's intended for a person like Rob. Rob's the ideal candidate. He's already at his probably ideal weight. He just has a little trouble area, so it's going to reduce fat in that area.
Okay, I just completed 2 minutes of massaging, and you can see it's a little red. How do you feel?
Oh, fine.
Great. Okay, so now we're going to get ready to do the other side.
Okay.
It hurt? Doesn't hurt, right?
No, it doesn't hurt. Feels a little numb.
A little numb. Typically, it does feel a little bit numb. Can we treat multiple areas at the same time? We do treat multiple areas every day. It's going to depend on your availability, your time. But you can come in and get a full spectrum of treatment of your full body, and that's the usual occurrence for people that have a lot of areas that need to be addressed.
So right now I'm getting his other side ready. Sorry.
Okay.
I'm using a pre-treatment wipe on his skin to cleanse the area. And it's putting a film protective barrier on the skin as well. And you do this for about 1 minute.
Okay, what does that feel like? Does it hurt?
No,
No?
not at all.
It's a little cold.
It's a little cold. A little
Okay.
tingly, but that's okay.
A little tingly. All right, good.
You mentioned earlier about post procedure
Yeah.
massages and things if we're
Yeah.
some discomfort in the next week or so.
Yeah, you're not going to have discomfort, but it might feel a little bit stiff, okay?
Oh, okay.
And that's just the fat, the fat's going through a process of being eliminated by your body. So that takes time, and as it's getting metabolized, that area can feel a little bit firm, a little bit woody. And you can just gently massage that, and it'll help it get better a little bit quicker than it normally would.
Gotcha.
So what I'm putting on Rob right now is a sticky gel pad, which will help adhere the applicator to his treatment area and also be used as a protective barrier between his skin and the cold applicator as well.
Chelsea, how long was that treatment? 35 minutes?
35 minutes
Okay.
per area. The applicators
Okay,
here.
if you guys have more questions, the Coolsculpting specialist can answer those questions after the conclusion of this session. Thanks for coming. Happy Father's Day. If you have more questions for me, you're always welcome to come in for a complimentary consultation. Come in and see one of the girls here. We do a lot of these. We've done over 10,000. We're pretty proud of that. Happy Father's Day. Thanks for coming in.
The Coolsculpting procedure is available worldwide. Results and patient experience may vary. Visit Coolsculpting.com for more information, including important safety information and indications in your country.